Think about how to treat psychopathy. It's a little bit complicated because it's not a condition, a way of being that can actually be totally removed. So, what are the things that we can do for treatment? There are several treatments, and they basically fall under the category of cognitive behavioral therapy, which is about not so much shifting the inner life and the perspective and creating deep insights. There's a little bit of that we do in traditional psychotherapy, although some psychotherapy can be helpful. But really creating a behavioral change, a way of changing the way one relates or moves in the world. So basically, it's not so much about changing it, removing it, but containing it, controlling it, managing it. A couple of therapies that are considered successful with this might be schema-based therapy, which has to do with understanding concepts of the way relationships happen, the way scenarios happen, and shifting the way one thinks about that. Then there's transference-focused psychotherapy, which is very similar. You're dealing with the internal life, with sort of what we call dyads, or relationships that exist within the person in their psyche, and shifting how they manage those relationships, perhaps creating behaviors that are more empathic, more attuned, the person would develop a greater ability, hopefully, to what we call mentalize, which is understand what's going on inside another person and in their world and what's important to them. People can be taught to manage their own behavior. And one of the things too that's interesting is that punishment doesn't work so well. It doesn't faze them all that much, but rewards work pretty well. So they get excited about getting what they want, about the reinforcement, about the input. Could be if you're in on a ward, or even incarcerated, maybe gifts or, cigarettes, or ability to have another phone call. These kinds of things are much more motivating than negative and punitive responses. So for children, I think we can be very hopeful, much more hopeful than we used to be, because they're malleable, they're impressionable, they're still developing, their brains are still developing, and environmental influences can be helpful. Not all the time. So some parents have tried many, many things, and they might feel kind of alone because what they tried didn't influence. I do want to put in a word for no parent blame here. There are genetic components to this. And so I think it's very, very important, just as an overall context, to stay away from parent blame. Because parents who are very loving, very caring, very nurturing and attentive can have a child who is troubled in this way. I would say the main thing that I often tell people is getting over the guilt and getting over the shame, and realizing it isn't your fault, because you can get very caught up in self-criticism and flogging of the self. Really developing some self-compassion, some distance. You're a human being on this earth, your child is a human being on this earth, in the case of children, and you do the best you can to get supports. Supports for yourself are really important, whether it's friends, spiritual advisor, other parents who've been through something like this, professional support in the terms of a counselor or a therapist. But I think for the child, or for the person who suffers from this limit setting, is actually, maybe that sounds harsh or as if it's taking something away, but limit setting can actually create a much happier life. I like to quote Cicero, I'm not sure if I'm getting it exactly right, but man has laws so that he can be free. It's kind of a basic human need. And we cannot be free if we feel oppressed by what may be coming from this loved one who has aggressive tendencies. And they themselves are sort of victims of their own aggressive tendencies. And that's something else I would like to move into, is what are these self-destructive tendencies? Because they do exist in people who suffer from psychopathy. It's kind of intuitive. I mean, when you think about it, if you're overly confident and you don't have a lot of anxiety, and these are traits that they also possess. And you're pretty grandiose and you feel pretty entitled and you don't do a lot of planning and you're impulsive and you just sort of throw yourself into things. You may get away with that for a long time because your charm and your excitement and your charisma just wows people and makes them sort of lose their critical thought of what you're doing because you're so blinding in your charm. But eventually, people might make really terrible mistakes financially or interpersonally. There's errors of judgment that are very hard to undo. And so there are ways in which it can become a very self-destructive way to live. And people who have psychopathy can suffer the consequences of their actions in really big ways, because maybe they're going to lose their job, or maybe they're going to end up with a lot of debt, or maybe they're going to lose the respect of other people. And if they're very concerned about image, or which is also falling into the narcissistic spectrum because there's overlap, the sense of humiliation might be very great and very painful. The other thing that could be put into this category of self-destructiveness is there's a sense of not real relationships, which might create a sense of loneliness actually deep down. I mean, you could say maybe they don't care that much about relationships, or those kinds of intimacies don't feed and nurture them. They're not succored for the way they are for many people. But, when you get older, it's harder to pull off these sorts of characteristics. And there's an isolation that may come with having this condition and having made some errors in judgment that led to consequences that were self-punitive.